There is, as many people, or most people know now, there is a new or relatively new virus that is circulating in the Middle East, particularly in Saudi Arabia, called the Middle East Respiratory Virus, MERS virus. There have been 2 cases, as I understand, identified in the United States. Both of them have been from the Middle Eastern travel, although there is now evidence of another case that has been in contact with one of these cases who has developed signs of having been infected. And so this is a potential now for another one of these possible large-scale outbreaks. So it is certainly a risk that has to be taken very seriously, and we need to prepare for it, as we do for any of these pandemics, such as influenza. Unfortunately, in a way, the term pandemic is used differently in different circumstances. And technically, for epidemiologists, a pandemic is just global spread of disease. But for influenza, it specifically relates to the change in the influenza virus, what we call an antigenic shift, which means that the virus has changed its genetic form. In the other diseases, such as MERS, there is no strict definition of when it would be called a pandemic, other than widespread disease. So at the moment, although it's now in 2 regions, so as to speak, of the World Health Organization, and that would fit an influenza pandemic warning type of threshold, this has not yet been applied to any other disease other than influenza. I believe that in the future they will develop the same kind of warning levels, or the alert levels that have been developed for influenza. Even those are still developing, and they are not the same as what they were originally. So now, for example, there are 4 levels. Previously there were 6 levels. So this is evolving.